Designee of the Minority Leader.
Mr. Speaker, I ask for unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and to submit extraneous material into the record.
Without objection.
Thank you, Mr. Speaker. I'm here as one of the co-chairs of the Doctors Caucus here in the House of Representatives. And I'm here to talk straight with you and with the American people and my constituents about this tax plan that is being worked on by my Republican colleagues that will explode the deficit, but that will also hurt every single person in this country by making the biggest cuts to Medicaid and to food benefits ever. And I want to make clear as I talk about this how reckless it is, and that even people who do not rely themselves on Medicaid will be impacted this. So I'm outraged. We're talking about a $715 billion cut to Medicaid. That is the largest cut ever. It will kick 13.7 million Americans off of their health insurance. And let's just be really clear about why they're doing this. This isn't to balance the budget. It's not to deal with the deficit. In fact, this bill is exploding the deficit. This is to pay for a gigantic tax break for the wealthiest people in this country, for example, Elon Musk. And to think about that transfer, taking health care away from the people in my district and across this country and transferring it to the wealthiest Americans, it is morally bankrupt, and it is also fiscally reckless, because doing this will essentially collapse our healthcare system in the United States of America. That's why just last week we spent 26 and a half hours in the Energy and Commerce Committee discussing this very thing, telling the stories of our constituents, painting a picture of what it would mean to cut 13.7 million Americans off of their insurance. Now, you know, it's interesting that this whole discussion didn't start until 2 o'clock in the morning, because my Republican colleagues didn't want to have this discussion during the day when people would actually hear it. So they waited until the dead of night to bring up this topic of taking health care away from our constituents. Now, in the state of Washington, 1 out of 3 people rely on Medicaid. I'm going to tell you, most people who do, they don't even know it, because in Washington state, it is called Apple Health. So if you ask people if they're on Medicaid, they'll say no. If you ask them if they're on Apple Health, they will say yes. And this represents the most vulnerable people. These are kids, they're pregnant women, they're people with disabilities, they're the elderly in nursing homes. These are the people who need our help the most. So I think about my patients. I'm a pediatrician, and I think about the ones who have Apple Health. And if they didn't have that, if they didn't have access to come see me, their primary care pediatrician, and get diagnosed early with a mild pneumonia or an ear infection or whatever the case may be, they would be forced to go to the emergency department for that care. It's not like they're not going to get sick. They're going to get sicker, and they're going to go later when things are more expensive and more complicated. And you know what else? Even if you're not on Medicaid, so I think about my patients with private insurance, they're going to be waiting in that emergency department line too. They will have broken an arm, have some other emergency, and they're going to be waiting in a longer line. We all know that the lines are already long to be seen in the emergency department. The care there is the most expensive care you can get. The lines are the longest lines. And somebody's going to pay for that care. Otherwise, hospitals go underwater and they go out of business. And who is that? That's the people who are not on Medicaid, who are paying private insurance premiums, and those premiums are going to go up. It's going to hurt individuals who buy their own insurance. It's going to hurt the businesses, the companies that employ those people. And so this hurts everybody. I want to tell you the story about Isla. This is Isla. She's 4 years old. She was born in 2021 in a rural part of my district after an uneventful pregnancy. But right after she was delivered, something went very, very wrong. She was in dire straits, was clearly sick, needed emergency care, and thank goodness this rural hospital has a labor and delivery unit, so they were well equipped to resuscitate a baby, to stabilize her, and then to life flight her to a hospital that could provide the specialty care that she needed. Well, let's just think for a moment about if Medicaid gets cut and these rural hospitals see a disproportionate share of Medicaid-dependent patients. Either those hospitals are going to close or they're going to start cutting back services, and I will tell you that the first service to go is labor and delivery. So what if that had happened after these Medicaid cuts? What if Kittitas Valley Healthcare didn't have labor and delivery? What if Isla had been born then, had not had the specialists there, had not had the ability to resuscitate there in the delivery room? She would not have made it. And that's what we're going to see when we start, or when they start, cutting away at Medicaid, closing rural hospitals, fewer labor and delivery units. More people will get sicker, they will get poorer. Children like Isla would not make it. And that's what I mean when I say it collapses our whole healthcare system. Our healthcare system, it's like a three-legged stool. One of those legs is Medicaid. And if you start taking that away, the whole system collapses. And that's what we're talking about. Hospital closures, taking away services, long waits in the emergency departments, and a population that is sicker and that needs more care, and that care becomes more expensive. It hurts us all. And that's why I'm so outraged that this is the mechanism that my Republican colleagues want to use to pay for a tax plan that will give gigantic cuts to the wealthiest taxpayers in this country, a la Elon Musk. And that is unconscionable. I wanted to start with that, and I'm really honored to yield time to our Speaker Emerita, Nancy Pelosi, from the great state of California, and I will yield her 5 minutes.
Thank you very much. Mr. Speaker, I'm pleased to receive time from the distinguished Congresswoman from Washington State. She is a pediatrician. We have all learned a lot about how public policy has a direct impact on the health and well-being of the American people. And when I hear them talk about cutting over $700 billion in Medicaid, and it's just waste, fraud, and abuse, this beautiful child is not waste, fraud, and abuse. I will talk about a little child in my remarks who was not waste, fraud, and abuse. This special order comes together to shine a bright light on the Republican plan to fund tax breaks for billionaires and by making huge cuts to Medicaid. Now, that's what it looks like. But the fact is, they will still, with their tax bill, be adding over nearly $4 trillion to the national debt to cover their tax break for the wealthiest people in our country. This is fiscal engineering to reduce the role of government in the lives of the American people where it is most needed. Where it is most needed. This is Robin Hood in reverse, taking resources from where it is most needed, the people who need it most, and giving it to those who need it less, the billionaires in America. This is shameful, and it is a fraud, and it's a shame. Now, President Johnson reminded the American people when he signed Medicare and Medicaid, he traveled to Independence, Missouri, to be in the presence of President Truman, former President Truman, who had worked on this when he was president, but it came to fruition under President Johnson, and he went there and he signed the bill in the presence of Harry Truman. And he said, he said this, he said, President reminded the American people of a shared tradition, never to be indifferent toward despair, never to turn away from helplessness, never to ignore or spurn those who suffer unintended in the land that is bursting with abundance. Indeed, Medicaid saves lives as a pillar of health, security, and justice for tens of millions of Americans. People often think of Medicaid as health care for poor children. That would be justification enough, health care for poor children. But it also is a middle-income benefit for nursing home residents and people needing it for long-term care services. They get that largely through Medicaid. And it is also a benefit for people with disabilities. The Republicans' devastating budget plan would push about 14 million Medicaid recipients off life-saving health care and leave countless vulnerable families exposed to catastrophic medical bills. This is terrible because this is about health and financial health that is being devastated. Working families and children with low-income working families and children with low-income households would face ruinous consequences, as would rural hospitals, as the distinguished Congresswoman has mentioned, families seeking opioid addiction treatment for their loved ones, and middle-class Americans with long-term care needs. Mr. Speaker, I ask unanimous consent to insert a statement from the California Medical Association into the record. This is what they have said about this. California Medical Association, Shannon President, issued the following statement regarding House Republicans' proposed care cuts in Medicaid. The latest federal proposal to gut Medicaid is reckless. Physicians and hospitals will be pushed to the brink, forced to close their doors, and unable to continue care for their patients. Because, you know, when this funding leaves those rural hospitals, not only do the Medicaid patients lose, but all of the patients in that rural area lose. That's my injection here. Back to the statement. These would be the largest Medicaid cuts in history and will leave veterans, seniors, the disabled, children, and working families without health care coverage, as the distinguished physician colleague has said, making emergency rooms the only point of care for millions of people. Communities will be devastated, lives will be lost. This is the CMA. Congress must reject these cuts and instead focus on strengthening the safety net that protects us all. Otherwise, at least 13.7 million people will lose health care coverage. Republican attacks on health care impact real people, including little children. My guest at the President's State of the Union address was Elena Hung, mother of Giamora, a courageous little lobbyist of 11 years old. Giamora has complex medical needs, including chronic lung disease, chronic kidney disease, and global development delays. She has a tracheostomy. What do you say? How do you say this? Tracheostomy? Tracheostomy. She has a tracheostomy, a ventilator, and she is ventilator and oxygen dependent, and uses a feeding tube. Access to quality, affordable care ensured that Giamora received the care she needed during the extended hospitalization and can now live at home with her family. And Medicaid has helped Giamora receive the therapist she needs to catch up with her developmental milestones, including physical therapy, occupational therapy, feeding therapy, and speech therapy. But these very lifelines from Medicaid and more are what Republicans are working to destroy to give a tax cut for billionaires. Democrats are standing strong against the administration's many attacks against family health care. This is just one of them. And with this special order, thank you, Dr. Colleague, we are calling out Republicans to either vote to protect their constituents' health care or vote to take it away. That's the choice. In stark contrast to the president and Republicans in Congress, Democrats will always fight to lower health care costs. We are unified and ready to use every tool to stop this GOP scheme. And we will always work to strengthen pillars of health and financial security in America. That includes Social Security, Medicare, and Medicaid. We will always fight for Medicaid. I just want to go back to that one thing. They're still adding nearly $4 trillion to the national budget to give tax breaks to their wealthy billionaire friends, In the bill that they passed when Trump was president before, oh, I said his name, and the Republicans were in power, when the Republicans passed that bill and the president signed it into law, 83% of the benefits went to the top 1%. To the top 1%, adding $2 trillion to the national debt. They're doubling down on that, getting to almost $4 trillion to the national debt, and saying, we got to give all this money to billionaires and call children waste, fraud, and abuse in our Medicaid system. It's really sinful. It's really sad. And it is something that I hope the Republicans will reject. And I hope their constituents will call them, because these Medicaid people are in Republican districts. One of our colleagues in California has, out of all of our constituents, he has nearly 500,000 people on Medicaid, and yet he voted with the Republicans on this. Well, you can be sure he'll be hearing from his constituents, because people know. And I'll close by saying Lincoln said, public sentiment is everything. With it, you can accomplish almost anything. Without it, practically nothing. But for public sentiment to prevail, people have to know. And we are making sure that your constituents know and that they are informing you of their knowledge of what you are doing. Republican reverse Robin Hood. Thank you very much for the opportunity to share some thoughts about this and for sharing the story of this beautiful little girl. Thank you. I yield back to you.
Well, thank you, Madam Speaker Emerita Pelosi, for your moral clarity and your fiscal pragmatism and painting a clear picture of what is going on right now. I would like to yield. I'd like to yield 3 minutes to Representative Balint from Vermont.
Thank you so much, Representative Schrier. Happy to be here. You know, just this morning, President Trump said that Republicans aren't cutting anything meaningful in their budget. Wow. What a thing to say. What a shocking thing to say when these cuts will hurt so many Americans. I'm having a really hard time understanding how taking away health care from nearly 14 million Americans isn't meaningful. It's not meaningful that rural hospitals across Vermont and across this country are going to be at risk of closing. You know, just today I met with Vermonters from a little town called Coventry, and they're deeply concerned that they are going to lose access to labor and delivery health care at their local hospital. Republicans are so out of touch with the reality of American families right now, and it's shocking to call these cuts not meaningful when their bill will hurt working families. It takes away food and health care from millions and millions of people, their own voters, but yet they are not meaningful cuts. These cuts are certainly meaningful for all the kids and veterans who will go hungry because of this cruel and what I think very cynical bill. And why? Why are my Republican colleagues making the cuts? That's what we all want to know. To give the very wealthy another big tax cut and deliver tax breaks to billionaires and corporations. People who absolutely don't need any more assistance. So taking that money from people who desperately need help and giving away to the people who don't. People who are just struggling to get by are having precious resources taken away from them. And right now across this country, Americans are trying to figure out the math. Are they going to be able to afford groceries for their kids? They're trying to decide whether they can afford to go to the doctor. And while that's happening in real time, my colleagues are spending time demanding more work requirements for Medicaid recipients when we know that almost half of adults on Medicaid are already working. They act like they're not working. They're working. And 27% of those working age adults on Medicaid are disabled. They're doing the best they can here, folks. It couldn't be more obvious that they are just looking to remove more people from the Medicaid rolls in order to have more money to give tax breaks to billionaires and corporations. And it's sick. These are people, real people that we're talking about tonight, in every congressional district who cannot handle these cuts. It's as simple as that. And the reality is Americans can't pay for their rent right now. They can't pay for their groceries. They're too high. Prescription drug prices are too high. And costs for consumers and small businesses are just going to go up because of the asinine tariff regime that we've been dealt. And of course Americans feel like it's rigged against them, because it is. And that's why we have to be here fighting for them. That's why we have to be here raising the alarm about what is happening in this bill with Medicaid. What Americans want is fairness. What they need is fairness, and we owe them that. And they want and need affordable health care, and we owe them that. And they want and need a fair shot, a better life for their kids, and we owe them that. This bill that cuts Medicaid, it is a statement of values. It shows exactly what and who the Republicans are caring about. And it's not you and your family, and it's not me and mine. It's about propping up billionaires and kicking the rest of us in the teeth while they do it. And I ask you, what kind of leaders take away health care and food from working people so that the wealthy can get even more money? What kind of leaders? Not strong leaders, not leaders of conscience. It's shameful. I yield back.
Well, thank you, Representative Ballin, for that clarity. I so appreciate drawing that distinction that Speaker Emerita Pelosi referred to as reverse Robin Hood. That is exactly what's going on here. Who are you standing up for? We saw with the last Republican 2017 tax cut that the vast majority of that benefit went to the wealthiest, and it did not trickle down to people. People are already having trouble affording rent, home prices, food, and other goods. Putting this kind of financial pressure not just on Medicaid recipients, but on everybody else, because insurance rates and medical costs are going to go higher, only makes that squeeze worse. I am going to yield now 3 minutes to Representative Takuda from Hawaii.
Thank you, Mr. Speaker. I rise today with a warning, no, a plea. Rural America is already in crisis. People there die younger, mothers face greater risks giving birth, and hospitals teeter on the edge of collapse. Medicaid is the thin lifeline that fragile systems are using to hold itself together. Cut it, and people will die. At Adventist Health Castle in Kailua, 75% of patients rely on Medicaid and Medicare. They've weathered already the storm of COVID, but with new GOP-led cuts to provider fees, they may be forced to shut down essential services, obstetrics, pediatrics, emergency services, care that literally keeps babies and people alive. But this is not just about one hospital in Hawaii. This is a national crisis. Rural Americans face significantly worse health outcomes and health disparities. In too many rural counties, life expectancy is a decade shorter than that of their urban neighbors. Maternal mortality in rural areas is nearly double that of urban areas, and more than 200 rural hospitals have closed their doors since 2005, and over 450 more are currently at risk of shutting their doors. This isn't hypothetical. It's happening right now. And let's be clear, when these providers and hospitals close their doors, everyone in those communities, including, by the way, some members of Congress and their families, will lose their health care. And it won't bring me or anyone impacted any comfort or peace to say, I told you so. Suma Metla, a pediatric physical therapist and mom, treats kids with complex needs. 40% of her patients are on Medicaid. She told me plainly as she sat in my office today with her 1-year-old Kashi, if these cuts pass, we will not survive past this year. Already, speech therapists and other specialists are shutting their doors in Hawaii and across the country. Her own practice is buried in a 2-week backlog, and one of 2 hospitals that offer similar care, and we only have 2 throughout the state, has a 100-child waiting list right now. Suma has traveled to Lanai to treat children no one else could reach. She tried to keep care going through telehealth, but when Congress let those tools expire, families were left stranded. Or let's talk about the preschool teacher in my district whose son was born weighing less than 2 pounds. 5 months in the NICU, emergency surgeries, feeding tubes, a hospital bill 50 times more than she will make in a single year, covered by Medicaid. That little boy is now 3 years old, full of life and laughter and love, obsessed with music and trucks. He is only alive because Medicaid was there. We cannot forget, my friends, what is at stake. These are not just numbers on a page. They're real lives, real children, real families, and real communities, people like you and me. Slashing Medicaid won't balance the budget. It will close hospital doors. It will rip care from those who need it most. It will end lives. We must not let this happen. Find the courage, have a conscience, vote no. I yield back.
Well, Representative Takuda, thank you for bringing up that particular issue of children in the neonatal intensive care unit where I have worked, and I think about this frequently, that when over 40% of births in this country are covered by Medicaid, I think about what it would mean for a family to be bankrupt for the rest of their lives if they had a premature baby or a special needs baby. And I also think about what would happen if those babies didn't get the right care. Sometimes this is not a matter of life and death, but a matter of life, death, and lifelong disabilities. And that's what a good NICU care will mean and make a difference for with these babies who are relying on Medicaid. I'm now pleased to yield to my colleague, Representative DeSaulnier from the state of California.
Thank you, and thank you, Doctor. I'm reminded of the first oath you took before you got here, first do no harm, that I wish my Republican colleagues would take that oath, because the harm that this proposal does to the least amongst us in this country is unfathomable. It's cruel, and it's madness from a financial perspective. When everyone is cut off Medicaid, where will they go? They'll go to public hospitals that already are underfunded and trying to serve the least amongst us. So all the stories you've heard, I want to put some numbers and think of multiplying these numbers to the stories you've heard, but particularly for people who are the least amongst us as Americans. There are 78.5 million people enrolled in Medicaid and the Children's Health Insurance Program across America. This is 10% higher than in February 2020, pre-COVID. 1 in 3 people with disabilities, 1 in 3 people with disabilities, 15 million, have Medicaid. Comparatively, 19% of adults without disabilities have Medicaid. These are the people that Republicans and Democrats in the past have tried to protect. Now we are being cruel and dismissive of their needs. 1 in 5 Medicaid enrollees have a disability. 2/3 of Medicaid enrollees do not receive SSI benefits. 10.3 million people would lose Medicaid coverage in the next 10 years if the budget reconciliation bill of the Republicans passes because of its punitive work requirements. Most of these people are already working. In 2022, Medicaid covered 2/3 of all home care spending. 4.5 million people receive Medicaid-covered home care services each year in America. Medicaid cuts, as proposed under the Republican budget, threaten optional benefits the most, including long-term services and supports that help the disabled and the elderly, and home and community-based services that help protect these Americans who need our help. They live with disabilities in their own communities and get the support, love, and affection of those communities and their families. In California alone, almost 15 million Californians are on Medicaid. 1,906,300 Californians on Medicaid have a disability. Of those, 992,000 people are working, age 19 to 65. 1 million people in California with disabilities who get Medicaid are working, and now they're going to be forced to go through a bureaucracy that supposedly the majority wants to make more efficient. That's not efficiencies, that's cruelty to the least amongst us. 68% of California adults on Medicaid have a job. In just my district, which is the 5th wealthiest district in the House, 131,634 people are on Medicaid and are at risk of losing care under the Republican budget. 45,916 of those are children, 19,000 are seniors, 10,000 are people with disabilities, 48,300 adults on Medicaid due to ACA expansion. Mr. Speaker, this is madness. Doctor, colleague, thank you for bringing this to the floor, and thank you for your spirit and your personal testimony to what this will mean to a million of Americans who are the least amongst us.
Well, thank you for your comments and putting this in a very personal way. You know, I'm wondering for people out there watching, if they're thinking, gosh, I wonder, is this really true? I mean, are hospitals really going to close? Are we really going to lose labor and delivery and have to drive hours to get to the nearest hospital to deliver a baby? I mean, in my district, the hospital I talked about earlier is between 2 mountain passes. And if it's snowing, there's really nowhere to go except by life flight. And it's not hyperbole. I have sat with the heads of school-based health clinics and community health centers, with heads of hospitals, with nursing homes. And by the way, these hospitals, we've been referring to rural hospitals, but you know what? There are urban hospitals and suburban hospitals that are also highly dependent or have a very high percentage of Medicaid-dependent patients. And we're already seeing cuts of hundreds of employees in the Seattle area because of these impending cuts to Medicaid. So I want to be just crystal clear. This is absolutely true. We are hearing this across the board, that when Medicaid gets cut, we all lose. We lose our local labor and delivery service. We lose our local emergency room. We lose the ability to be seen quickly in the event of an emergency, because somebody who could have been taken care of by a primary care physician a couple of days earlier with an uncomplicated illness is now in the emergency room ahead of you in line, making you wait when you're having a heart attack, and it was completely preventable by using the leanest, most efficient healthcare service and insurance that we have, called Medicaid. I want to tell you another story. This is the story of Miguel. Now, we talked about Isla before, a little 4-year-old girl. Miguel is at the other end of life. He is a senior. He is a constituent who is dependent on Medicaid. He's actually a 76-year-old widower who lives in Wenatchee, the apple capital of the world. Now, after Miguel's wife passed away, he relied solely on his Social Security check to cover his living expenses. He's a retired orchard worker, and so he worked hard to earn that Social Security, and he spent decades doing physically demanding labor without access to a pension later, and private insurance was never affordable. He still depends on Medicaid to stay in his modest home, receiving regular in-home nursing visits and help with daily tasks like bathing and cooking and managing his medications. And without Medicaid's coverage for home-based care, which, by the way, is far more affordable than nursing home-based care, he gets that home-based care and transportation and care coordination through Medicaid, and without that, he would have no way to attend his checkups, manage his diabetes, and function through the limitations that he suffered because of a stroke. Miguel fears losing access to the services that allow him to live at home with dignity, with independence, in familiar surroundings, and he deserves that. And frankly, that is the most cost-effective way to help Miguel. For seniors like Miguel, Medicaid, it's not optional. It's their lifeline. It's how they keep dignity. It's how they stay at home. And unfortunately, Miguel's fears are not unfounded. The rural hospital that he depends on treats patients who are more likely to be on Medicaid or Medicare. In other words, they have a disproportionate share. And if these patients, those Medicaid patients, lose their health insurance because of this bill, the cost of their care gets absorbed by the hospital. And for hospitals in rural areas that are already struggling, barely keeping their heads above water, this could be the death blow. This will force them to first cut services, and we talked about labor and delivery. We could also talk about mental health services and opioid treatment. Those are often the first to go. This would leave Miguel without access to care. I am not trying to fearmonger or deceive Americans, but this is scary. It is real. I am simply telling you what our community health centers and our hospitals and our nursing homes and our school-based health clinics are telling you, that the Republicans' budget will take health care away, health insurance away from 13.7 million Americans, all while therefore increasing costs for everyone, decreasing access to care, and leaving us all sicker and poorer. Now, we haven't even talked really about the impact on nursing homes and on our seniors. Speaker Emerita Pelosi touched on this, but I also want to be really clear that 3 out of 5 middle-class, working-class Americans in nursing homes depend on Medicaid to pay those bills. We already in Washington state don't have enough nursing homes. In fact, people who should be in nursing homes are now filling hospital beds because there's nowhere else to go. Well, just imagine if more nursing homes close, what that will do to hospitals, what that will do to those patients. But then think about this. I'm in the sandwich generation. If I had a parent who relied on Medicaid to be in a nursing home and could not otherwise afford that, I would need to leave my job to take care of my parents. And that's not what they would want for themselves or for me or for my family. And this is what millions of families out there will go through if these Medicaid cuts happen. I would be honored to yield to Speaker Emerita Pelosi.
Just briefly, I just want to make this further point. You have been so eloquent, and all of us associate ourselves with your remarks and the professional knowledge that you bring, the intellectual resource you are on all of this. I just want to add one thing that is just at the same time as the Republican reverse Robin Hood plan is taking from those who need it most, giving it to those who have the most. They are also taking nearly $300 billion from SNAP. SNAP food, that's for food. Food is medicine. You're going to make people even more sick if the children don't have food. There was one time when Medicaid first began that one of the people who was starting community health centers around the country insisted with the federal government that food be counted out of them as medicine, because it is about health. And children who do not have access to food are the ones who suffer the most. I see that our colleagues have arrived. I'll just say this one thing. People ask me, what is your why? Why did you ever decide to leave home and come to Congress? I have 5 children, and the idea that 1 in 5 children in America goes to sleep hungry at night, lives in poverty and goes to sleep hungry at night, and this the greatest country that ever existed in the health history of the world, I just couldn't handle that. So that is what took me from kitchen to Congress to the housewife to House Speaker, to feed the children. So this thing, what Matthew said, when I was hungry, you fed me, the Gospel of Matthew, what do we do with that? Just tear it up. This is immoral. It's sinful for us to be taking food out of the mouths of babies to give tax cuts to rich people. But you know what? It isn't about that. They're giving those tax cuts anyway. They're fiscally engineering the shrinking of the compact that we have with the American people, that developed countries have with their constituents. We are behind the rest of them in many of these regards when we have to take food out of the mouths of babies to say that we're going to give a tax cut to the wealthiest, but we just really are taking food out of the mouths of babies because we don't want to feed them. And that's what this is about. $1 trillion, $700 billion or more for Medicaid, $300 billion for SNAP. Reverse Robin Hood, a la Republicans. I yield back. You're here.
Thank you. I so very much appreciate those comments and Speaker Emerita Pelosi's dedication to children in every way. And just to put an even finer point on that, food is medicine. Cutting SNAP benefits not only takes food away from hungry people, it also undermines our economy because those dollars are spent at our local grocery store. But I also have to just mention that food banks, which are the next line of support, are also under threat because Doge and Elon Musk and Donald Trump have cut the food going to those food banks, leaving shelves barer and leaving food banks having to ration foods. And they canceled the program where local farmers can provide their food to the local food banks, which is the healthiest and local and fresh food. And all of this just adds up once again to hurting people in need in order to fund a tax cut for the billionaires in this country. I'm now going to yield to my colleague, Dr. Kelly Morrison from the state of Minnesota, to give her perspective about Medicaid.
Thank you, Representative Schrier. Mr. Speaker, today I rise alongside my colleagues in the Democratic Doctors Caucus and as the first and only pro-choice OBGYN here in Congress to speak out against the Republicans' disastrous budget proposal and to fight for our families, women, children, and families. For more than 20 years, I've had the honor and privilege of taking care of patients as an OBGYN. And one of the great joys of my job is caring for my patients during their pregnancies and helping them grow their families. I carry my patients and their stories with me, and they inform my work here in Congress. I think about them and all the challenges new parents face during pregnancy and then after they head home with their new baby, recovering from the delivery, adjusting to life with a little one, accessing the care they and their family need, balancing caregiving and work, making ends meet, the cost of raising children in the United States. It's a lot. And I think about all the babies I've delivered whose moms got their health care through Medicaid and how critical that was to help them get off to the best possible start. And it's because of those patients and patients all across the country that I stand here today both incredulous and outraged that the Republican majority in Congress is shoving a budget through that will gut Medicaid, the very health insurance program that covers 40% of all births and ensures almost half of all children in our country. As an OBGYN, as a mother, as a member of Congress, as an American, this is unconscionable to me. We already have a maternal health crisis in our country. Let's look at the facts about that maternal health care crisis we face now. And remember, that is before we gut Medicaid. In more than half our country, women do not have a place to go to get obstetric care. Among our peer nations, the United States has the highest rate of both maternal and infant deaths. In 2022, there were more than double and sometimes triple the rate of maternal deaths in the United States compared to most other high-income countries. And unacceptable disparities exist. Black and American Indian and Alaska Native women are 3 to 4 times more likely to die from a pregnancy-related cause compared to white women. And most of these deaths, more than 80%, are preventable. So what is the Republican majority doing to address this unacceptable crisis? Instead of working to find ways to improve women's health and to help moms and babies, they are shoving a budget through that will devastate our nation's maternal health care and decimate many of our hospitals and clinics. It will unequivocally make our nation's maternal health crisis worse. And why in the world are they doing this? Why are they choosing to harm women and children? They're doing it to pay for tax cuts for the ultra wealthiest among us. That is literally why. To make the math work to cut taxes for billionaires. They are choosing to sell out the health of women, moms, new babies, the future of our country to pay for tax cuts for billionaires. Choosing to take health care away from moms and their babies. And let's be clear, this won't just be devastating to the moms and new babies who get their health care coverage through Medicaid. It will be devastating for maternal health care across the country. All of this coming from the party that calls itself pro-life and pro-family. It's hard to imagine a more anti-family policy. So instead of wasting time musing around ridiculous ways to persuade women to have more children, like giving medals for having 6 or more babies, I would like to remind my Republican colleagues that they could start with something real, meaningful, and impactful right now by not gutting the health insurance program that covers almost half of all births and half of all children in our country. The Republican majority needs to make their pro-family rhetoric match their policy, put America's moms and babies first, and stop these proposed cuts to Medicaid. I yield back.
Well, Representative Dr. Morrison, thank you for that perspective, from the perspective of an OBGYN who has taken care of pregnant women and new babies and really paints a very clear picture about maternal mortality in this country, what cuts to Medicaid mean for that. You know, it's interesting. All of us in the Doctors Caucus have been talking for years, in fact, for the whole time I've been in Congress, trying to improve Medicaid reimbursement, to make it so that Medicaid reimbursement can match Medicare reimbursement, so more children can have a medical home, about expanding Medicaid care for pregnant women until 1 year postpartum to make sure that they are healthy and plan their pregnancies, and that we can cut down this outrageous incidence of maternal mortality in this country. And now we're just fighting to keep Medicaid. That's the situation we are in now because Republicans want to gut Medicaid and take health insurance away from 13.7 million Americans to pay for a tax cut for the wealthiest Americans. That is just plain wrong. I'd like to talk for a moment about another constituent of mine, paints just a different angle on what it looks like to cut Medicaid. And I will tell you that our phones, they're ringing off the hook. People understand what is going on. They're worried for their health, for the health of their families, for the health of their parents. They get what will happen to their local rural hospital if these go into effect. So I want to tell you about Kathleen, who graciously shared a story about her own mother. Kathleen's mother lived to be 92 years old. She was a widow for 42 of those years and helped care for 5 of her grandchildren. Kathleen's mom, well, she lived through the deprivations of the Great Depression and World War II and was never one to complain. She lived simply. In the last decades of her life, she had a number of serious, complex medical conditions that presented real challenges for her medical team and for her specialists, and of course for her. Medicaid supplemented her traditional Medicare plan in the last years of her life and allowed her to get the medical care that she needed. She was treated with care and with respect. When Kathleen's mom injured herself in a fall, Medicaid covered the rehabilitation facility and later in-home physical therapy and occupational therapy so she could be in her own home. Later, she had a life-threatening event and was hospitalized, and eventually she was well enough to move to an outpatient rehabilitation facility, followed by in-home care. Again, Medicaid was there for her. The care was safe and reliable and appropriate, and it gave tremendous relief to her and to her family. Now, in the last months of her life, Medicaid provided hospice care. The nurses and home health aide and OT and PT and case manager were her guardian angels. They treated her with compassion and dignity. Isn't this the type of treatment and care, the care made possible by Medicaid, that all of us deserve, that all of us want, that we want for our friends and our family and for ourselves? For so many seniors in this country, this type of care is made possible thanks to Medicaid, and it is unfathomable that my Republican colleagues want to deny our seniors the type of comprehensive and compassionate and thoughtful care that Kathleen's mother received. And that sort of brings us full circle to how these cuts to Medicaid, Apple Health in Washington State, something a lot of people out there think, well, I'm not relying on Medicaid, and so maybe it doesn't affect me. And what I want, the message I really want to deliver, Mr. Speaker, I'm actually going to look at the camera to speak directly to the American people, that cuts to Medicaid or to Apple Health, they impact every single person in this country. They impact you if you are the son or daughter or spouse of a senior who needs to be in a nursing home, because nursing homes will close and you will have to leave your job to take care of your ailing parent or spouse. They impact everybody who lives in a rural community or in an urban community where there's a lot of patients who rely on Medicaid insurance, because when Medicaid doesn't pay the bills for those people, the hospital gives away that care for free. And then either they cut services or they close, or more likely a combination of all these, and your insurance premiums go up because somebody's got to pay, and who's going to make up the difference? Private insurance. That means your insurance rates go up, and they're already high. Everybody hurts from this. Even if you're not paying your own health insurance, I bet you at some point you're going to the emergency room, and those patients who don't have Medicaid, they're now getting sicker, waiting longer, and going and getting their care late in an emergency department. And so if you think the waits are bad now, because hospital beds and ER beds are full of patients in mental health crises, or with fentanyl overdoses, or with nursing home patients who don't have a nursing home to go to, if you think the waits are bad now, just wait till 13.7 million Americans lose their health insurance. We are all impacted. If you live in a rural area, you have private insurance, you're doing fine, but the labor and delivery department closes at that rural hospital, and you maybe have a high-risk pregnancy and need obstetrics care and might have a complication with that delivery, you might have to go live in a more urban area for the month before that delivery just to make sure that you're safe and that your baby is safe. This is something that none of us should have to worry about in the United States of America. This is a prosperous country. We have excellent health care here. And to think that my Republican colleagues want to cut Medicaid, a lifeline for the patients who depend on it and for our entire healthcare system, that they want to cut that the people most in need depend on. Again, we're talking about the elderly, people with disabilities, pregnant women, children. To think that they would cut care for them in order to pay for gigantic tax cuts for billionaires, it's a backwards transfer of money. It is Robin Hood in reverse. It is just plain wrong. And I've explained now, and in addition to being morally bankrupt, it is also fiscally reckless. It's irresponsible. And I just don't understand how this is the plan that my colleagues came up with. Their constituents are going to hurt every bit as much as mine. And statistically, with more rural areas and more vulnerable, already vulnerable rural hospitals, chances are their constituents are going to get hurt even more. I sure hope that people out there are paying attention. Call the people who represent you. Tell them what your fears are. I know people are calling me, and I am standing up here appealing to my Republican colleagues, letting the American people know what is going on right now, why they should be concerned. This is a democracy. Call the people who represent you. Tell them what you think. Tell them what it would mean for you, for your family, for your neighbor. Again, it's 1 out of 3 in Washington state. What would it mean if these largest ever cuts to Medicaid transpired? Here's what's going to happen tonight. At 1 o'clock in the morning, the Rules Committee is going to meet. They're going to craft the rules for this, well, Trump's so-called big, beautiful bill, which would be a travesty for the people I represent. They're going to do this at 1 o'clock in the morning when everybody else is asleep. They're not watching. They're not paying attention. They're not watching the nightly news. This is not prime time because I think they're embarrassed about what they're doing, but they're going to do it anyway. They're going to do it for the people who are in the front row at President Trump's inauguration. That's who they're going to do it for. This is not helping their constituents. It's not helping my constituents. America, it's not helping you. It is morally bankrupt, it is fiscally irresponsible, and it's just plain cruel. And so that is why I, along with the rest of the Doctors Caucus, have spent this evening talking about what this means for our patients, for our healthcare system. We understand it on a visceral level because we have lived in and worked in this healthcare system. We have worked in crowded emergency departments, seeing people who, if they had health insurance, wouldn't need to be in the emergency department. We've taken care of patients who didn't have insurance like Medicaid, and so they delayed care, or they didn't pick up a medication because it was too expensive and they didn't have coverage. We've seen these things. Dr. Morrison and I have both seen complicated pregnancies, neonatal resuscitations. These are patients who rely on Medicaid, and we're here saying, as doctors who swore an oath to our patients to protect them, to stand up for them, this is us standing up for our patients, to plead with my Republican colleagues not to cut Medicaid. And I want to let them know, and I want to let my constituents and the American people know that I will continue to fight every minute to make sure that these cuts don't happen and that we keep this oath to our patients. Thank you, Mr. Speaker. I yield back.
Members are reminded to address their remarks to the chair and not to a